My name is Lindsay Helm. I'm a PA here at Numinus. Along with managing a patient panel, I am an instructor for NumiU, and I also work with our clinical research team. Applied psychedelic-assisted therapy is a course that really gets into the nuts and bolts of psychedelic-assisted therapy. Each module has a specific focus, so we really get to get into the details and the weeds of cases and talking about how we can apply these different medicines across a variety of different mental health concerns and other challenges that people are dealing with in their lives. So this course is for anyone who wants to really understand how to use these tools in their own practice, whether that be in a medical practice, in a psychotherapeutic sense, and we even have folks who are unlicensed and wanting to use the tools you can learn here in other ways. I love teaching this course because it gives me the opportunity to talk about what I've learned in practice. What I've done so far in this course is present cases of real clients who I've worked with, and it gives me a chance to talk about my work in a really personal way and share and also learn from learners. There's always so much rich discussion, and I learn something every time I teach this course. Yeah, so I got into psychedelic therapy in a meandering sort of way. As a new PA, I started in primary care, and I worked in primary care for several years. And I loved my patients, but the majority of my patients had really chronic and sometimes very serious illnesses. And I did a lot of pain management and diabetes management. And particularly with my diabetics, we talked all the time about lifestyle and habit change that would help support their health. And there were so many of my patients who had such a difficult time with this. And I felt like I needed more tools that would help people with habit change, more tools that would help people get to the underlying reason of why they were in a state of poor health. And those weren't tools that were available to me or to my patients in the setting I was in. And I really felt in so many cases that I wish that psychedelics were available to my patients. I wish that I could talk to my patients about these things, but I felt really constrained. And so I turned my career path towards psychedelic medicine and dedicating myself to bringing these things to the community and patients who I care for so deeply. So working through a course of psychedelic therapy with somebody, and in my clinic work, I'm working with ketamine, and in my clinical research work, I am involved in psilocybin trials and LSD trials. But regardless of what compound I'm using, there's a scaffolding of preparation and integration sessions that surrounds an actual dosing session, which is anywhere from an hour and a half to 12 hours. And this amount of time really allows you to build such a deep and trusting relationship with the person you're in the room with. And really being able to connect with someone on a very human level that psychedelics allows. I mean, it just feels good as a human to be in connection with other humans. And that's what this medicine allows us to do with people. And again, regardless of the substance, I think that that's where the true medicine is this ability to connect.